Hello everyone, our lecture is about the contents of the pelvic cavity, part 2, prostate, prostatic urethra and urinary bladder. This prostate is a glandular structure located in the pelvic cavity of the male between the neck of the urinary bladder and the pelvic diaphragm. Look to this picture. There are small tube with a 3 cm called prostatic urethra that begins at the neck of the urinary bladder. Descends in the prostate and divided it into incompletely 5 lobes. The anterior lobe that located anterior to the urethra, while middle lobe located between the prostatic urethra and the ejaculatory ducts, while the posterior lobe located behind the urethra and below the ejaculatory ducts. Right and left lobes located on each side of the urethra. This urethra continues inferiorly and piercing the pelvic diaphragm and become as membranous urethra. Relations of the prostate. Superiorly, this neck of the bladder, while posteriorly pelvic diaphragm. Anteriorly pubic bones with the pubic symphysis, and posteriorly the rectum. Blood supply of this, the inferior vesical artery that is a branch from the internal iliac artery. Urinary bladder. Urinary bladder, this with capacity reached to the 500 milliliters, located in the hypogastric regions just behind the pubic bones. Relations of this: superiorly coils of the ileum with sigmoid colon and body of the uterus in the female, while inferiorly is the retropubic fat and the pubic bones. At the apex, pubic symphysis, and at the base it's rectum, this rectum, and vagina in female. Thank you for listening.